All right, good afternoon, everybody, or good morning for some of you that may be calling and it's still morning time. This is Amanda Pierce-Kelly. I'm the National Advocacy Director at NAC. We are going to go ahead and get started to be respectful of everybody's time here today. We're already moving through the slides. So we really appreciate everybody joining us today. We want to take some time to walk you through the brand new Health Center Advocacy Network website. This is our brand new home for the Health Center Advocacy Network. It replaces the Campaign for America's Health Centers website, the Save Our CHC site. So today what we want to do is just kind of go through introductions, which I'll do in a moment here, walk you through some of the new elements and the navigation around the site so that you can easily access resources, and hopefully share in our excitement about this really wonderful new site and set of tools to bring us into the current century and just continue all the wonderful momentum we've seen around our health center advocacy strategy efforts and the network growth as a whole. So you can see the agenda there. We're going to go through the homepage, the menu items, the site functionality. We also have some exciting news and some insight into a brand new social media campaign we're going to be pushing. Some of you may have seen it. Some news come out about it just this morning. And then from there, we'll open it up to take questions and respond to any inquiries that come in. Just a couple housekeeping items, and I'm just going to do my best to advance the slides here. There we go. Housekeeping, if you do have questions during the presentation, you go ahead and use the chat box on the bottom of the right-hand side of the screen there. Unfortunately, we've run into major issues in the past with taking folks off of mute. We always prefer, frankly, to have open dialogue during our webinars and any of our trainings. But because of technology and issues in the past, we tend to at least start with using the chat box. So if you have questions, please don't be shy. Enter them into that chat box. You can put them out to a specific panelist or speaker, or you can put it out to the entire group. We will do our best to either take them as they come and or take them at the end of the presentation. So again, make use of that wonderful little tool, chat box at the bottom there on the right. So with that, we can move on to the next slide. The Health Center Advocacy Network. We are so excited about this new identity that we've launched just in the past month or so. And I also want to introduce you all to my truly wonderful team. In terms of the network, we'll start there. You all helped us to get where we are today. And the reason that we've pushed this brand new identity with this wonderful new logo that you see and created this excellent new site and all of the accompanying tools is because we've grown and we need it. And frankly, you, our health center advocates in the field, is what is helping to drive that growth. And we are continually striving to make sure that we are not just keeping up with the very best tools and resources and technology to support the Health Center Advocacy Network, but to be sure that we're innovating. We want to stay ahead of the curve, not just, keeping up. And so this brand new Health Center Advocacy Network identity, brand and appearance, and then all of the website tools, materials, and resources to support that are in keeping with that effort. Just to give everybody a little bit of context in terms of the network, when I started with NAC in 2005, we had fewer than 5,000 advocates. And now, mind you, we were a much smaller program, health center program as a whole. It was just as the second Bush administration was really starting to push their growth agenda with the healthy counties. And then from there, we went into a really wonderful time through the stimulus package and saw even more growth. And then, of course, through the Affordable Care Act and healthcare reform, we saw even more growth with the Health Center Trust Fund. And so today, we're no longer so small. Today, we're just under 110,000 health center individual advocates that compose our Health Center Advocacy Network. Now, if you take into account, and sometimes there's different ways that we define the network proper, which is folks that we have in our database that we can reach and that we have profiles for and that we're able to communicate with directly. That number is just under 110,000. Now, when you take into account the network as a whole, and that considers all of our social media advocates and a number of different outlets that help compose that total all-in under that one umbrella network, we're actually getting nearer to 130,000, which is incredible. So the growth, just as I said, since 2005, to go from under 5,000 advocates to nearly 130,000 today, that's because, again, of the work that you guys have done. It's because of your commitment to advocacy. It's because of my team, and a lot of blood, sweat, and tears on the part of many folks around the country that have helped to build and create the Health Center Advocacy Network as a whole. And so as that growth has occurred, particularly in the last couple of years, we recognized that we needed an identity as a network that would stick, that people would recognize and be able to identify regardless of the issue or the campaign that we were working on. And so while we fully expect to have many sort of ever-changing advocacy campaigns, they will all fall under the Health Center Advocacy Network. And so this growth of the network as a whole has really propelled us into a new era of advocacy, and that's what we're here to talk to you all about today. I want to introduce my team really quickly, and then I'm going to turn it over to them because they truthfully get all of the credit for building this incredible site and populating it with the content and the resources that I hope you all will find helpful. We have Dorian Wanzer, who is our manager for grassroots advocacy, outreach, and communication. She's also the person that manages our social media handles, so hopefully you're already following us on both Twitter and Facebook under the Health Center Advocacy Network handles. If you're not, please take a look. Dorian is responsible for the content that you see coming from those two accounts, among many other things, one of which is managing our network and keeping our website up to date and creating new resources. We also have Alex Harris, who's our manager for grassroots advocacy special populations. Alex is our go-to person on all things technology, frankly. She's a real guru when it comes to that. And her portfolio and responsibility puts her at the lead on our Hispanic advocacy program. She's also doing a lot of work to build out specific advocacy programming on patient engagement and any number of other things. We also have Elizabeth Kwasnick, who's our grassroots advocacy manager. Elizabeth runs point on our Key Contacts program, on the Health Center Advocacy Centers of Excellence program. She's also working on some really fantastic new advocacy programming to engage Health Center board members. And really, these three people are responsible for all of the incredible work you're going to hear about today and driving our advocacy programming here at NAC forward. Of course, with great direction from the input we receive from you all in the field. So with that, I am going to turn it over to Dorian to walk you through the first portion of the presentation here today. Again, if you've got questions throughout the presentation, you can go ahead and type those into the chat box, and we will take those up if it's appropriate during the presentation and otherwise at the end. So Dorian, I'll turn it over to you.
Hi, good afternoon, everyone. This is Dorian Wanzer. I hope everybody can hear me. I'm going to begin by just going over our website, and I'm going to do a screen share with everybody. So if you just give me 1 second, then I'll be sharing the Health Center Advocacy Network website. Okay, it looks like you should all be able to see the Health Center Advocacy Network website, and we're just going to kick it off with the home page. As you can see, it looks very different from Save Our CHCs, definitely a lot sleeker. Just to kind of kick it off, there's three major buttons in the middle that you'll see there. Those are our stop and shop places, I guess, where you can become an advocate, take action, or spread the word. I will click on each one of those shortly. I just want to go over a couple more things. And just so you can put a name with a face, as Amanda just introduced us, you can see here in About, you can learn about Health Center advocacy, about health centers, and then you can see who we are. And so here you'll be able to see all of us, the advocacy team, so Amanda, Alex, Elizabeth, and myself. And if you click on our names, you are able to contact us directly. So just keep that in mind. So going back to the home page, like I said, you can click on Become an Advocate to sign up if you're not currently registered. By clicking here, well, it says, hi, Alex Harris, we're on Alex's computer, but she's already registered. But that's one of the great things about our website. Once you've registered, it's going to your information will be remembered. So as you continue to visit the site, you won't have to put in your information time and time again or have any type of duplicate sign up there. So you can see, you can have the choice of putting in your, obviously you'll put in your information. You can choose your health center name from a drop-down menu, which is something that's new and much easier than before. And then you can also select your health center connection, how you're related to a specific health center, the address obviously, and then down here you're able to select how you want to be communicated with by our team, whether you want to receive text messages, you can get a weekly advocacy summary, maybe you want to receive communications in Spanish, or maybe you don't want any of your information on the site at all. You have the option of selecting those things and updating your preferences. So that's one of the great features of the site. I'm going to go back to those 3 home buttons. Obviously, take action, that's the most important thing that we do as health center advocates. If you click on the take action button, it will lead you to a series of steps, but if you click on take action in this top menu, you can find your elected officials, you can see some information about fixing the health center cliff and making the case for health centers, and then I'll go over this later, but you'll get some information about the Value CHC social media campaign that Amanda mentioned. So by clicking take action, it'll take you to this page, and you can click any of these options to either update your information, make sure you're signed up. You can also share your health center story, and then of course you can spread the word about health centers. So in terms of spreading the word, which is one of the most important things and one of the things that we encourage, as Amanda had mentioned, social media. If you click there, then you're able to get access to our new badges for your website if you're interested in showing your support for the Health Center Advocacy Network. You can also get some information about online advocacy engagement. Our social media guide is here. You can connect with us on Facebook or Twitter. You can see some social media posts. And you can also get information on in-person advocacy recruitment. And if anybody has any questions, again, feel free to put them in the chat box. The other thing, so back to the Take Action tab at the top line, which I said is one of the most important parts of our site, you can find your elected officials, which you can do by filling in the form here. You would put in your email, your home address, and zip code, and then your legislator will populate. You can also, like I said, learn about making the case for health centers. These are the critical action steps that we want to make sure that everybody's aware of as we, move forward with our advocacy and make sure that we have adequate funding in the upcoming years and fix the health center cliff. Many of you have seen this in other webinars that we've done, so I don't want to dive too deep, but as you can see, we're promoting instituting an advocacy plan. There are template documents there. There are template documents to engage your state elected officials, and then of course you can engage your network by spreading the word, which I was just on the spread the word page, and all of that information is there. Going back, one of the other things which I will make a plug for at the end is our Value CHC's social media campaign. It is another way to take action. The purpose of the Value CHC social media campaign is really for our advocates who are not going to be able to attend the P&I but want to engage with their legislators and let them know what health centers mean to them. We're really encouraging that you can share a photo, an image of you at your health center, an image of health center activities. Use the hashtag ValueCHCs in a creative way. I saw something today, Oklahomans value CHCs. You can say I value CHCs, we value CHCs, however you want to do it. And, you can obviously have your own unique reason. And we're going to be monitoring who's been using the hashtag specifically on Twitter, and whoever really is able to really make a splash and get a lot of retweets and make a real impression will be featured at least in our national communications and on our website. There are guidelines and terms and conditions about the campaign that I'll let you guys look into more later. And there are also some sample social media posts available if you click down here. So if you have any questions about that, please let me know, but we've already gotten some great participation, and it's a pretty easy way to take action if you've already completed everything else that we've been asking you to do. So without any further ado, I'm going to click over to resources because Elizabeth is going to be going over that.
Great, thanks, Dorian. And before I get into this, I'm going to answer a couple of questions that came through. The first one is, how is this different from Save Our CHCs? And the easy answer there is that the Health Center Advocacy Network replaces Save Our CHCs and the Campaign for America's Health Centers. You have seen on social media, we've transitioned to our new handles and our new, I guess, the searchable name or whatever you call it on Facebook. And for the time being, Save Our CHCs will redirect to the new website. So folks can visit either URL and get directed to our new and improved website. So hopefully that answers that question. And then Dorian mentioned that you can select your health center connection when you're signing up. And the point for that is really for us to be able to better target and segment our communications and our database. I can give one specific example. She also mentioned the ACE program. There is an element of that requires you to sign up your staff and board. So we're really just looking to find out who is in our network, who are the folks that are receiving our communications, and hopefully moving forward we can do a better job of getting you the proper information or what's most relevant to you. So that is for use internally on our end, and hopefully that answers that question. So I'm going to jump over to Advocacy Resources. This is our new sort of hub for all of the different tools and other information that you can download and check out. You can see that we've broken it down on our new site into sort of constituencies. So if you're a health center leadership and staff, there's a resource hub for you. If you're a board member, there's a resource hub for you there. And for your patients and community members, we've got a separate section there as well. And you probably remember from our old site and our old identity, we still have the Advocacy 101 Toolkit. And I'll click on that, which has the basic information, the advocacy do's, the legal do's and don'ts, creating that culture of advocacy. All this good stuff is still there, hopefully in an easier to access, more user-friendly format. So the other things at the top, if you sort of hover over the resources, and I know Alex is going to get into the events part, but we do have a separate tab for advocacy events so that you can sign up for webinars and other activities as well. The next tab over at the top is our programs list, and this is where you can find more information on the Advocacy Center of Excellence program, Grassroots Advocacy Leadership program, the Hispanic Advocacy program, and our Key Contacts program. And these are sort of more, it's less of a resource that you can download as an individual and more things that you can get involved with at the health center level, or if you're trying to just get more engaged in our programming. And each of these has their own separate page, and you can access more information. But that's where the clearinghouse for all of our specific programs is. And then the last thing I'm going to click over to is our blog, New and Improved. You can scroll down and go through all the old posts. We've transferred over the content from our old blog, so if you're looking for something that was, prior to, the transition, it'll be there. But this is what our new blog looks like. The two most recent posts will be at the top, slightly larger than the ones underneath. But yeah, I think that's really all there is to say about that. So I will turn it over to Alex to talk about the rest of the stuff.
Sure. Thanks, guys. And just as a quick reminder, if you have any questions, please put it in the chat box. We designed this program, this webinar today, to be a little light on our end so that we could just answer your questions about where to find some of the resources you guys are used to using, how to use some of the new functionality of the site, and just really dig into it with you, because as things get busier, as the Policy and Issues Forum is coming up, we've got a lot of stuff coming down the pipe. We want to make sure you guys are comfortable finding everything that you need and being able to take action very quickly and easily and promote that action as well. So I'm going to talk really quickly about the Spanish language of the site. First, de un defensor. This section on the website is basically a very mini website in and of itself. It has a lot of different resources and information that is specifically in Spanish for our Spanish language advocates. So when you click on that Sea un Defensor section, you're going to get to this initial page, which gives you a quick 2-minute video about what it means to be an advocate. It's a good video for sharing if you're trying to promote advocacy with your network. There's subtitles in English if people are bilingual. You can also sign up as an advocate here, just as you would on the home page, except this form is in Spanish. So the same information goes into our network. They get to choose different tags if they want emails or text messages, and put some of their health center information in here. But essentially, it's the same form as the front page form, just in Spanish. You also have the link here to take actions, the same action steps that Dorian showed you guys in Spanish. These action steps we consider to be sort of patient and community friendly. So they're things that you don't necessarily have to be the advocacy coordinator or lead at your health center to work on, things that anybody could do. So we've got that available in Spanish here on the site. More information about advocacy. This gives an overview webinar about health center advocacy basics and some slides and just information about the importance. We've got a bunch of resources here. You can see we try to make this pretty visual and user-friendly. That's kind of our, if you guys haven't noticed, our point with the whole site. So we've got, slides here, obviously a video, some images, infographics, sign-up forms, so lots of different ways that you can print out and share different resources that encourage folks to sign up as advocates. Just as we have on the home page, again, we have a spread the word page here entirely in Spanish with those resources for spreading the word in person, and then all of those great links for spreading the word online. And then, where did I go? Oh, and then the ASE program, which of course is the Hispanic Advocacy Center of Excellence program, the way that you can achieve A status by targeting some of your patients and community members around your health center. So that's the Spanish language section. It doesn't necessarily have every single resource that we have on the website in Spanish, but it has a lot of some of the more essential ones and hopefully everything that you would need to get started kind of spreading the word in your community and among your Spanish-speaking patients. The next thing I want to talk about is our events, which Elizabeth referenced, and I'm really, really excited about this page because for those of you who are kind of wondering what the difference is between the Campaign for America's Health Center website and this website, this is one of those features that is brand new. So we're really happy to be able to offer this. Basically, we have an event calendar, so every single major advocacy webinar, phone call, conference, anything like that, we basically have a link to here on the events page. So a lot of you guys signed up for this webinar by RSVPing directly on the website, which is a new capability we weren't able to do before. So you'll now get reminder emails about this, not from our webinar software, but directly from us at the Health Center Advocacy Network if you RSVP on the website. So definitely if you're looking to sign up for upcoming webinars and events and just check out generally what kind of training we have going on and that we're offering, it's all here on the events page. And then the other great part is the past events are really easily accessible. So if you're wondering where webinar recordings and call recordings are being posted along with webinar slides, it will all be on hcadvocacy.org/past_events. So we list it here by month, and newer stuff is at the top. So if you guys are wondering, is this webinar going to be recorded and can you access this information at a later date? The answer is definitely yes. It takes us usually a couple of days, up to no longer usually than a week, to process the recording, but then we'll get it up on the website here for you shortly, and you can always find it right here at past events. So pretty exciting. I do want to dig a little bit more into the spread the word feature. And if you guys have noticed, at the top of every page, you can link to what we think are the 3 most critical links on the site: spread the word, take action. and become an advocate. So we've got all these resources here to help you spread the word through your social media pages and in person at community events. But at the bottom, you'll see some links that you can use to share pre-populated messages on a bunch of social media outlets, Twitter, Facebook, LinkedIn, Google+, and email, of course. And these messages contain basically this unique tracking link. So you have a personal tracking link that you can use in any communications you send out, and anybody who signs up as an advocate using that link that you sent them will be connected to your account in the network. And so we're pretty excited about it because if you guys, you know, in theory want to have some type of competition of advocate recruitment, or you want to see how effective some of your recruiting efforts have been, you want to see, like, if you asked 100 people to sign up, how many actually signed up. If you use this personal tracking link consistently, we'll be able to get that information for you. And so that's pretty exciting. I think, you know, a lot of times, I know I do this when I send out a call to action or I ask people to take action. I always think more people take action than actually do, because I think maybe I just haven't bugged them enough. This is a good way now we can actually track some of that data and see if it's working or if it isn't working. And also it's just a good way for you to see, you know, the breadth of influence that you can have. You know, the more people that you send this out to and the more channels that you use, the greater influence you're going to have. So it's a pretty cool tool. If you decide you want to start using it and you want to sort of get some initial thoughts about how well it's going, feel free to reach out to us. We're happy to help with that. So that's the spread the word feature. That's kind of a new piece of this website as well. We also have a really awesome toolkit feature, search feature, which is brand new. So if you're looking at this website, and even though you think, you know, of course, everything's organized very nicely, we tried really hard to get it organized nicely. If you just can't find anything, it's always nice to have a search feature available. So I'm going to see if Dorian can type in, like, toolkit or something.
Okay.
Or resources.
I'll do the toolkit.
So yeah, so she wanted to find the Advocacy Toolkit. She didn't see it up here. She wasn't sure where to go. She put in Toolkit, and boom, it's the first link here. So that's a pretty nice use of the site. I think if you guys aren't able to find something at first glance, please definitely use the search feature. And if you notice anything's not popping up right, or you're not finding anything quickly still, of course, always reach out to us. That's super important to us too. Speaking of reaching out to us, we have a contact us form here. So obviously, hopefully, most of you guys have our email address and our phone number. But if you don't, there's some information on here, and you can leave a comment in here on the Contact Us page. So just another way for you to get in touch with us if you can't find something or you have a request or something. That's a good thing to do. And then finally, I did want to talk about the Share Your Story feature. So that's one of these action steps that you guys saw that we, again, consider to be patient-friendly, things you can easily share with your network, asking them to take action on supportive health centers. So that second one here is share a quick sentence or two about why you value your local health center. You can see we're trying our best to put everything in Spanish and English where it's possible. But here we're just prompting people to say, I value my health center because. Share a few sentences about the value that your health center brings to the community. If you can upload a picture, you can see a few folks have uploaded pictures and agreed to share them. That just kind of adds a nice touch. We're collecting all the stories on the back end, and then we'll have that data and that information that we can then put out through social media and through some of our publications and our advocacy resources. It's super, super helpful to have that compelling personal information. So I definitely encourage you guys to check out this page. And then I think that mostly covers the pieces that I was going to go over, but Elizabeth, do you have any questions? All right.
Yeah, if there are not any other questions, quickly, I would just like to show you guys the links just to our new, as Elizabeth had mentioned, our new social media pages, our pages that are updated with HC Advocacy. So if you go to the very bottom here and you click on Follow Us, if you click on the Twitter icon, this will take us to the HC Advocacy Twitter page, which you can see is in sync with the website in terms of colors and logo and the handle as well. Here's an example of one of the a great Value CHC's post, which I'll get back to in a second. And then same thing, our Facebook page has also been updated. Has also been updated I'm sorry, you're kind of seeing the back end, but with the HC Advocacy with logo and handle as well. So if you're looking for us on either one of those platforms, just keep that in mind. You'll be searching for HC Advocacy. But just once again, I wanted to go back, and I guess I could have showed that. Well, I'll show more of actually the Twitter page. But the Value CHCs campaign has been kicking off. People have been really getting involved, but it's a great way to show why you value CHCs. We want people to raise their voices. As you can see, Nevada PCA has been very active using it. Oklahoma PCA has been very active using it, and they're finding their own unique way. I mean, it doesn't have to be it can be a picture like this one you see here that's more of like an infographic, or it can be just a regular picture that you take maybe, of you at the health center. So however you see fit, but we definitely encourage you to, and I think I had just retweeted one, but we definitely encourage you. You can see here somebody mentioned Ted Cruz, Gateway CHC. If you are using the hashtag, we definitely would like you to tag your legislators. So you could say, hey, I'm trying to think of, I can only think of my old North Carolina Senator, Senator Hagan. Here's why you should value, or here's why I value CHCs, and maybe you have a picture obviously in this state at the health center, maybe a health center that she's visited, something like that. But the more that we get that out there, we'll continue to make a name for ourselves on social media and just continuing to engage our legislators, which is definitely important right now. So if there aren't any other questions or any other comments, then I guess I can kick it back to Amanda. I don't know if you want to close out, if you want to say anything else.
Actually, it looks like there is another question, and that is so the question is, if you use the Spread the Word link, you'll be notified of all who sign up on behalf of your organization. If you didn't use that link, is it possible to receive a list from the advocacy team? I'm going to tackle the second part of that question, and I'm going to let Alex, Elizabeth, and Dorian speak to how you can track in terms of what's available via the website. Yes, we are always happy to supply you with information and basic reports without, personal information or contact information in terms of the folks that are signed up at your health center. Part of the reason we're so excited about this new site is that we're working very hard to make sure that we can target our communications and provide advocates resources and information in not just a way that they want to receive it, meaning maybe they don't want email updates, they really only want to have podcasts or blogs or, video blogs or receive updates in text version, which is obviously limited. But the point is this technology allows us to hone in on that a bit more. We're also really trying to learn more about the interests and trends of our network, and that will drive, frankly, the way we create content and segmenting our programming so that it really is tailored to the interests of our advocates and, of course, overlaid with our policy and advocacy priorities. But the wonderful thing about this technology is that it allows us a lot of insight into how we can do a better job to supply all of that. The other thing that I would make a plug for is that the more information we have about you and that you supply to us in terms of profile information, the more effective we can be in achieving that sort of standard where we're really trying to hone in on, okay, this person really appreciates getting their information or communications via social media or text, or they are very interested in these particular issues within the health center portfolio or policy priorities. So it is worth the time. We obviously have a large and ever-growing network of advocates within the network, but if you haven't gone in and taken a look at what your profile looks like, I would just make a plug for that. It's going to serve you very well, and frankly, it will serve us very well in trying to do the best job possible to get you connected with the information and the resources that you need. In terms of the Spread the Word link, Alex or Elizabeth or Dorian, you guys want to tackle that first part of the question?
Sure. So if you use your personal tracking link, your recruiting link, we can see on our end who has joined the network from that link. So you will have to reach out to us to ask for that information, but we're happy to get it to you. We might not be able to get to it automatically, particularly right now, but we'll get it to you as quickly as we can. So yeah, at some point I think it would be amazing to see, and we all talk about sort of our wish list for the advocacy website going forward. It'd be amazing for you guys to be able to access that kind of stuff yourself. But right now, where we're at right now, that's not how it works. But don't hesitate, don't be shy to ask us for what you guys need.
Yeah. And also just another thing quickly, for those of you that are attending the PNI, we will be having another smaller showcase of the advocacy website. So if you feel like you didn't, get in your question or get all the information you wanted today, or if you're more of an in-person type of learner, definitely stay tuned for that. And there's another question that came in.
Yeah, so we have another question here about people who are signing up on those paper sign-up sheets that we showed you guys on the Spread the Word page to kind of help with your community events and some of your in-person outreach. We totally encourage you guys to use those sheets. Sometimes it's just easier if you can just see somebody sign up on a piece of paper than asking them to go home and sign up later online. Although probably the biggest plug that we should have made at the very beginning for this website is that it is mobile friendly. So I'm really pumped about that. It makes it way easier to do work when you're on the road, to shoot off a quick action alert. When you're in between meetings or you're running around at conferences and stuff like that, it just makes life a lot easier. So it is mobile friendly, but sometimes, like I said, it is just easier to see somebody sign up on a piece of paper in front of you. When you do that, just send us scanned copies of those papers. Again, we might not get that inputted into the system automatically, in the next couple of hours, but we'll get to it as quickly as we can, and we'll keep you guys posted. It's really better for us to do it on our end, because then we can put it in one spreadsheet and import it really quickly and make sure people are signed up to the correct email list and stuff like that. If you want to save us a step, you can always put it in a spreadsheet yourself. That's probably easier than you going through on the website and signing up, 15, 20, 100, whatever different profiles online. Just put that in a spreadsheet, send it to us, or just send us scanned copies, and we'll get that inputted from the back end as quickly as possible. And then I have another question here. If you're already an advocate and signed up on the old system, should you sign up again? That is a great question, and no, you do not need to sign up again. All your information is still saved, so we're still able to reach out to you. You can still go on this website, and access all of these features. No need to sign up again. It's not a bad idea to go to this Become an Advocate form and just, enter your email address, and if you want to add additional information or select different communications you want to receive, like Amanda said, just kind of update your profile. It's not a bad idea. It helps us, like we said, better communicate with you. But no, there's no need to sign up again just to access this. You can access this right away. And then, let's see, this other question we have, when we're advocating on behalf of the health centers, are there templates on what we should have the staff say to the elected officials? That's a great question. Dorian, do you want to show sort of where some of our current resources are?
Sure. So, sorry, let me just hover here. If you go to take action on HD Advocacy, and then you click on Make the Case, This is where you will find a lot of those types of materials, and then I'll also take you to interacting with legislators in general. But just in terms of what our focus is right now, some of the information in the template letters has a similar language that can be used when you're actually speaking with a legislator, and also several of our policy and advocacy update webinars, the recordings and the slides have that information as well. In terms of tidbits and statistics that you can share, we've got a great hub here with Health Center information and data, which will actually be soon be updated to reflect more recent years as research has come out with some new stuff. And then going down here with advocacy tools and materials, you'll also be able to see some template letters for state legislators and for state legislators to Congress and state legislators to governors that you can kind of regurgitate and use in the way that you see fit. In terms of just interacting with legislators, I'm going to go back for a second to the home page and just show you guys. So as you can see, just like the other site, we did have sliders, but these are just much better. You can learn how to interact with your legislators. Hold on, I've got to just find the link. Yeah, sorry, my bad. For working with elected officials, you can go to the Advocacy Tool Kit, and then you can click here. And this is really another kind of new feature. Our old website didn't have the functionality for this, but you can use these drop-down menus to look up your elected officials. You can get information on how to build and maintain those relationships. There's information about how to request a meeting if you're trying to do that, what to do on an in-person visit, what's the best time of the year or the time of the month to meet with a member of Congress, and then just other helpful resources. So how to prepare for a meeting, how to have effective communications during the meeting, and what to do when you want to follow up. So if you want to learn more about that, it's hcadvocacy.org/elected_officials.
And I don't see any questions in the chat box, but I'll just give it one last call for any other questions. Oh, okay. Great question here. How do you activate staff that have never done this before? They may not understand the nonpartisan nature of the issue or feel that the issue doesn't impact them, any major hard-hitting points. Gosh, that's like the hardest question we've gotten on this webinar.
Yeah.
Should we kick it off to Amanda?
Yeah, sure. So it's a really great question, and I think the exciting thing is that there is an increasing number of health centers that are engaging their full staff in advocacy, calls to action, and building a culture of advocacy more generally, but they're just beginning, and so we frankly get this question a lot. I think communication is key. I also would say that the communication, at least at the start, needs to come from leadership about why it's important to be involved and how folks can do it and engage. The one thing I would say is that if folks feel like their staff or their network could use some help in training, advocacy training, so that they feel more comfortable engaging, and whether that's sending an email, knowing what the legalese is around advocacy, the appropriate way to have a phone call, the best way to speak to our issues, all of these different things. We're happy to do that. That's something that we can help with, and often do so in coordination with the state associations, the primary care associations, and so forth, who are also a wonderful resource. But I think that it's important, again, to start with why they need to and should be, or have the option to, however you want to frame it, engage, and what's at stake. I think the number one thing that stops someone from engaging, there are probably two things, is feeling like they're uninformed and feeling like it doesn't connect to them personally. And so I think being able to explain how some of these issues do directly connect back to the health center, and part of the beauty of the Health Center Advocacy Network is that by signing up, it's going to plug you into a consistent flow of information on a weekly basis that'll help make that connection so that it is more clear. And we try really hard to connect those dots, because it's difficult at times when you have very complicated policy proposals and legislation to really drill down to what does this look like on the ground at the human level, at the health center level, and in the community. And so staying informed is a big one. And the other one, as I said, is just feeling comfortable and at ease with actually taking action. And sometimes that's as quick and as simple as clicking a button to send an email. We also work really hard, as hopefully as most of you know, to tailor and craft messaging that anyone can and should feel comfortable just clicking send, that it's an appropriate, nonpartisan, and a good message that represents health centers at the local level, but also on a national scale. I think the other thing that I would pull out of this question and really pause on is that it's not that we're bipartisan, we're actually nonpartisan, and we're legally bound to that. As a 401c3, we are not ever allowed to legally behave, speak, communicate, engage in a partisan way at all. And frankly, we have been successful in our advocacy and in our support at both the congressional and the state level because we have this really wonderful bipartisan support, because we are nonpartisan and we work with everyone. So we have just as many Republicans as we do Democrats who see the value of the health center model and the role that we play in the healthcare system and in the community in making sure that people have good access to quality care. And so that's part of what makes us strong and powerful, and we're also legally bound, as I said. That being said, folks are always able to, and there's a separate conversation around what they do as a citizen. They just need to be really careful and cautious around making sure that any action they're taking in terms of advocacy or statements in that way, where they may be specifically geared in a direction, that they're doing that as a citizen and not in their capacity as a staff member or in any way affiliated with the health center. So that's a whole other webinar, the legalese, which we're happy to get into another time. But I think you're right for this person that's asking the question. I think making the connection about how these issues impact them. One of the things that we go to as a best practice is including advocacy and what is happening in Washington and your state capital as a standard part of your staff meeting agendas. If you don't have regular staff meetings or as frequently as you feel might be necessary to keep people informed and explaining that impact, it may just be a staff newsletter or a board newsletter or some basic communication. You can cut and paste, frankly, from what we put out there, but just to get that in front of your network on a regular basis so that they can understand the impact. There's lots of other really wonderful best practices and resources available right now to help you do this and to both familiarize your staff and make them more comfortable with this process, help them understand the power that they have. I think that's the other big one, is this is about empowering them to have a greater voice. They're choosing to work at the health center, I suspect, because some part of them believes in the mission, and so this is an extension of that. And I think that's an important case to make with them as well. So I will stop there because I could talk about this for days, but if you have additional questions and or if there are things that we can do to help you specifically at the health center, please don't be shy. We put that email address out earlier. You can always email us there with questions and to coordinate in terms of trainings and anything else you guys need. So really good question. I don't know if Alex or Elizabeth or Dorian have anything to add on that.
Yeah, I think the only thing I would add is just if you visit hdadvocacy.org/culture of advocacy that you can see here on the monitor, it has some really great resources, again, on how to create an advocacy plan, how to incorporate advocacy into your meetings, involve your board, recruit colleagues, and things of that nature. So definitely visit this if you are trying to recruit and really share the importance of why health centers matter and get people engaged. Are there any other questions? I'm not sure if
I don't see any other questions here.
Okay. Alrighty then. Well, I'm going to just stop sharing the screen for a second and okay, I see the other question. It comes from, and we've got a few more minutes, it comes from Maryland. We have had employees concerned about registering as an advocate out of fear, I guess, and immigration. it looks like, I don't know, Alex, you might be the best person for that. You work with a special
Sure, yeah, I'm happy, and Marilyn, I'm happy to reach out to you to individually to talk through some best practices for it. But basically, I mean, I think what we've seen as effective strategies from health centers maybe serve a large immigrant population who are a little bit more fearful and hesitant to get involved, is just to lighten your ask a little bit and to lighten your messaging. So, you know, definitely talking about a 70% funding cliff that could, you know, close your health center doors to immigrants might not be the best messaging, as you guys probably know. So just saying, you know, hey, you can get involved in the community and here's how you can help out. Maybe the ask is that they pass out 5 flyers in their community. Maybe the ask is that they share something on Twitter or Facebook if they're using social media. Maybe the ask is that they recruit, you know, a couple of advocates. So it can be there can be simpler ways for people to get involved than necessarily the stuff that you see us send out a whole lot. So I think I'd love to chat more with you guys individually who have questions of that nature, because I think it's a huge issue. But really, at the end of the day, I mean, we really feel strongly here that everybody has an important voice and has an important role to play as a health center advocate, and no matter how small the action they may take, it is helpful. So, so I do want to make sure we get in touch with you and talk about the strategies you can use.
Definitely. Well, it seems, I'm not sure if there are any more questions. Just wanted to share this last slide with you. This is just our staff information once again, as I shared in the beginning. If you would like to get in touch with any of us, and you can see where we work in the country. And and then just one last plug for Value CHCs one more time. Sorry, they're a little bit small, but you can see some examples of how people have used the hashtag Value CHCs. My personal favorite is the one from the movie Say Anything. I guess Lloyd Dobler Value CHCs too. You can thank NVPCA for that. You know, just get creative and have fun, but the biggest and most important thing is really to let your legislators know, because you're obviously on this call for a reason, you're an advocate for a reason, and you should share that with the world. So thank you, and if there's nothing more, have a great afternoon.
Can I make one more plug, Dorian, and then we'll send them send them on their way? I would just make a big plug for next week's Advocacy, Policy and Advocacy webinar. This is our monthly webinar. It's on the 21st. Particularly for those of you that are going to be attending the Policy and Issues Forum, this is an important webinar. It will give you a little bit of a leg up on understanding our messaging and our policy priorities ahead of the conference. You'll also hear about some key sessions that you'll want to attend at the conference. For those of you not attending, it's also going to be really helpful to you because there is so much happening in Washington right now, and we've already talked about the importance and the value of staying informed. There's going to be a lot of advocacy activity back home that coincides with the Policy and Issues Forum, and frankly for the next few weeks. And so this webinar on the 21st is really your best opportunity to get up to speed and make sure that you have the information to be able to advocate effectively over the course of the next few weeks. So just a quick plug, it's on the 21st. You can RSVP on this beautiful new website under the events section that we've already walked through today, but just please mark the calendar, and if you've got questions on that front, let us know. And with that, I promise that's the last thing. Sorry to keep you guys another couple minutes, but thanks so much for being on the webinar today, and I think we're good to sign off. Have a great day, everybody.